And today I'll be discussing surgical treatment of an osteochondral defect of the lateral trochlea utilizing MACI and proximal tibial autologous bone grafting. This is a case presentation. So we have a 16-year-old male club soccer player with left lateral knee pain for 2 years with no inciting trauma. The pain is worse with deep knee flexion and has been refractory thus far to any sort of conservative treatment. Stands with a neutral alignment radiographically, has a neutral alignment, stable knee ligamentous exam, otherwise a pretty normal exam. Looking at the MRI, we see an osteochondral lesion of the lateral trochlea measuring roughly 14 by 13 millimeters with a depth of about 7.5 millimeters. So the plan at this point is to proceed with an arthroscopic assessment of the lesion. Upon arthroscopic assessment, the lesion was roughly 20 by 20 millimeters, and there was a large kind of 5 by 10 millimeter fissure that actually probed to the subchondral bone, which appeared to be compromised with quite a large cavitation. So we debrided any sort of loose cartilage, and he was deemed to be a suitable candidate for a MACI procedure. So we performed our chondrocyte harvest from the intracardial notch using this large ring curette. And then for the second stage, we planned an autologous bone graft harvest from the proximal tibia, and these are our planned incisions. So for the proximal tibia harvest, a roughly 3 centimeter incision planned, centered just above the pads, or just medial and inferior to the tibial-tubercle there. And then in order to access the lateral trochlea, roughly 8 centimeter incision planned center over the lateralmost aspect of the patella. Here we are just with the approach starting on the proximal tibia harvest, pretty straightforward. And then this is the Arthrex osteoauger that has a built-in stop to ream and harvest around 8 cc's of bone graft.